Good afternoon and welcome to this Grant County Opioid Committee meeting. It's Monday, April the 20th, 2026. It's 12:02 p.m. We'll go ahead and open with the pledge. And would you lead the prayer?
Sure.
Okay. If you would stand.
The prayer first.
Yeah, go ahead.
All right. Dearest Heavenly Father, we bow before you today and we thank you for the many blessings that you've given to us. Lord, we just ask that you would be with us now as we enter into this meeting and give us the wisdom that we stand in need of. And we just ask that you would continue to go with us here, not only in this place, but with all of your people this world over, and help us to make good decisions for the folks of Grant County. Lord, we ask that you'd forgive us of our many sins and shortcomings again and continue to go with us and help us. We ask all this in Jesus' name. Amen.
Amen. If you would face the flag, I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Judge. You should have received electronically as well, and as in your packet as well, the minutes from 2/17/2026. Are there any corrections or comments to those minutes? If not, I'd entertain a motion.
Second.
I have a motion from Mr. Brankel, second from Mr. Garcia to approve the minutes of the Grant County Opioid Committee meeting from February the 17th, 2026. All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign.
Abstain.
Is it majority? Mr. Harper, do you remember? Majority present? Yep. So most minutes are approved. We'll move on to item number 3, discussion responses from the Grant County Local Opioid Needs Assessment. If you recall, at the last opioid committee meeting, we sent a letter on behalf of the committee to various entities within the county to request information. So far, these are the respondents. So we'll go ahead with Community Foundation of Grant County, Indiana. Is Mr. Harper, you have information regarding that?
Not really much to add. Dawn gave us a nice information sheet with a lot of websites and information that you can get into in order to find out specific data. So that was
those websites with the information are linked in the document from the Community Foundation. So I will forward her specific document so that you can click on the links and read it yourself. I didn't realize that until I was putting the packet together, that the information is actually linked there instead of.
Thank you.
So she provided, the Community Foundation provided a worksheet of such with links to overdose prevention, overdose data.
Yeah, there's a couple of different databases. The first is the Indiana Department of Health that they have for the drug overdose dashboard. The second one is the general overdose data reports where the state has been compiling information. The third one is, it looks like a broader organization that maintains a lot of data and makes it particular to counties, including Grant County. And the last one is a CDC search engine. All of them, I've looked at all of them, they have as much information as you could possibly want on the subject. So.
Are there any questions or comments on item A? Move to item B. We also had a response from Bridges to Health.
All right, Greg, you want to come on up, talk a little bit?
Good afternoon, everyone.
Afternoon.
You have a flow chart of what Bridges typically does in our process on our peer support services that I think is fairly self-explanatory. And in that bottom right, you have some numbers on number of people we've seen, how we've provided different types of assistance to folks with substance use disorder. Many of those also are folks with criminal histories as well. So I know the sheriff and I have chatted briefly about some of that. So I'd be glad to entertain any questions. I didn't bring I can't pull it up my phone for some reason here. I don't have a copy, but I'd be glad to answer any questions you might have.
On the 31 months that you have here, snapshot,
Yes,
what 31 months are we looking at?
that is the past, from March, 31 months back. Yeah.
Okay.
We are doing a lot, as you see in there. One of our peers, Brian Blevins, many of you know Brian. We've been able to have really good success with getting driver's privileges reinstated and also criminal histories expunged, which are two of the biggest issues for employment. I've worked with offenders for years, and that is two of the biggest hurdles we find on trying to help folks get employment. So Brian is not specifically tracking employment results, but I know we are staying in touch with a lot of those folks for other services. So
When it comes to like the driver's license, the privileges have been revoked from the courts or the sheriff's
yes,
arrest.
state,
arrest,
their license are suspended by DMV for a multitude of reasons. Likely, the vast majority are suspendeds, DUIs, as a result of some of their other past criminal histories. So Brian has gotten really good at navigating that process, works with the judges on getting those orders signed that then go to BMV to get those reinstated.
Are there any other questions for Greg or? I appreciate the information.
Yeah, be glad. Look forward to working together.
The next respondent was Radiant Health. Anybody here from Radiant Health?
See anyone here. It provides a lot of information. On the last 2 pages, they give some additional observations and also recommendations. At some point, with all the information that we're gathering, he's going to need to come up with ultimately what to do with some of the money. So, Brady was nice enough to put that in there.
And they're not doing any in-house overnight type of treatment anymore, is that right?
Yes, I believe the inpatient unit is no longer.
I think they still have their emergency response.
Yeah, they still have them that go out, but I think they shut down some of their beds that they had talked about doing. Remember, Jason?
2 beds.
They've got 2 beds now only because they used to have,
That's whatever that wing was like.
yeah, because they've opened up a whole wing for that, but out of that, they only use 2 beds now.
How did that change the,
We don't know, to be honest with you. I mean, we know that Lisa Dominici was running it, and she's the one that got the ball rolling. And next thing you know, they have a new CEO, and we were advised that the majority of the beds were no longer available. So, yeah, I think some of it may have to do with funding. I'm not really sure.
so we don't have an alternative right now?
Innovation might come.
Yes, so they ended their inpatient services, but they still have the crisis unit. And so they can stay up there for a couple of days as they work with other agencies to send them to provide services for inpatient needs. But they no longer do inpatient services.
We still have inpatient in the county or they have to go out of county? Out of county?
Yeah, they can stay there for to a certain amount of hours, as they kind of work with other, providers like Parkview. I think is one of them. And so then they'll, set up a treatment plan for another, agency to do the inpatient care.
Are there any other observations or comments regarding the information? I'll ask us, how is Radiant Health funded? Do we know?
Between private and public funds. Between, Medicare, Medicaid, and also private pay insurance.
We'll move on to Hancock County Sheriff's Department to submit some information. Is there any questions or comments regarding our information presented? There's a lot of programs there.
Yeah, I will say, when we did the tour and met the sheriff, they're doing a lot of things pretty well down there.
Right.
But they're highly dependent on volunteers from the community, churches, civic organizations. And they're kind of an advantage down there where they have a lot of healthy churches and a lot to choose from.
I think you'll see most programs that are implemented in a jail, they do have a lot of volunteers, but they always have one person that employed that kind of coordinates all those things for them. In fact, we met with them last week, I believe, so kind of talked to them a little bit about what they do, things of that nature.
Mr. Harker, do you have anything else to add to that?
They provided good recommendations. Once again, there's a lot of programs that they offer. They've had a degree of success in lowering their jail population by using this. Mr. Brinkley, you and Mr. Middles were taking the tour down there at Hancock County Jail. Sheriff, you've been as well, right?
No, I haven't been to their.
Okay, we'll move on to item number 4, Jake Martz.
Yeah, I'll take, Jake was supposed to be here to talk about recovering residency. And this is really a combination of new House Bill 1296, which went into law. I have circulated a memo to everyone that described what that is. There is being described to me that the recovery resident situation is unregulated. And with this new law, that's going to change. The state's going to come in and permit everything. There's going to be a whole set of standards. What you received from me was a summary and a copy of the statute itself. As you'll see, the statute's not particularly long. It's a framework. The real nuts and bolts are going to be in the regulations that come out, and those aren't due out until July 1st. The law takes effect. I'm getting some nods. Is that your understanding too, Melissa? Yeah. Jake can come back and talk another date. But he can describe some of the difficult situations that have been coming up in the recovery residence area and the need for improvement. So, yeah, come on up, please.
Couple things. I'll speak to the recovery because core, we work with pretty much all the recovery houses here in town. And what we find is folks with a lot of passion, working a lot with volunteers, and the regulations and the oversight on a lot of those houses is all over the map, shall we say. Some use structured programming. Some are strictly faith-based, use abstinence only, don't use medication-assisted treatment that some of the other houses do. So some of the efforts at the state level are commendable to try and get some kind of a level playing field so we all know what we're dealing with. And then folks who get into it from the treatment side know that there are some ground rules and some consistency expected. Many of them have good results. Some are better than others. But I know from my experience working at Radiant Health for 4 years, heavily in the recovery community and then out Bridges, it is a very hit or miss proposition. So I know from my standpoint, there were a lot of us that were very much in support of the state bill to get some consistency. I know from my time at Radiant, we had what used to be called Grace House, what's now Radiant House. And because of Radiant operating that, it had operated under a lot of DMHA regulations and a lot of the other entities didn't have to. So Radiant House had a very strong reputation, some good success, a lot of programming in place, a lot of structure in place for the residents, those kinds of things. So that's as far as I can go. But from my standpoint, working in the community for a long time here at Marion, that's my experience and my background. If I could tag on a little bit on the previous conversation, when Marty and I were talking about the data, I realized once you were talking, Bridges, we just provided data. We didn't really provide a whole lot of background on what we do. Bridges is the home for the core program that used to be run out of Marion Health that funds peer support specialists in the community, which is what Brian and I talked about, the expungements and the reinstatements. But the peers routinely get calls to Marion Health. We respond to the ER. Our folks have worked in a jail in the past. Currently, we're not. The sheriff and I have talked a little bit about that, but I know some of that's just a bigger issue than what we can talk about here. But so the core program is a specific entity within Bridges, funded right now by grants from the Board of Health that are soon to be ending. We're trying to find some other funding to keep those folks employed. Our folks are duly certified as community health workers and peer support specialists. There's a lot of overlap in those two positions, but it allows them a lot of freedom, especially working in the emergency rooms and within the community, to do a lot more than just recovery work. So that's our niche kind of in the recovery community. Is our folks do a lot of referrals. We average 4 to 5 a month to long-term treatment. Our folks are heavily engaged within our recovery community, doing a lot of work in either hosting or attending support programs, bringing us hope, NA, AA, those kinds of things that are heavily embedded in a lot of places in this community. So if you have any questions about what Bridges is actually doing beyond the data, I'd be glad to ask them. But I thought that might provide some context for some of the data that we provided, rather than just having that data out there kind of in a vacuum. All right, thank you.
Thank you.
Hey, Greg. Could you talk about the need for recovery residents.
Oh, yes.
That's part of why the state got involved to
Yes,
such a degree to put in a statutory
Yes.
regime.
recovery residents, sometimes you'll hear them referred to as transitional housing, sober living housing, recovery housing. They are an essential component for a lot of what happens to keep people, when they get out of treatment, to help them on their recovery journey. Good houses provide supportive programming, groups, access to mental behavioral health services, those kinds of things that let people, once they go through an intensive, say 30-day treatment and get out of that, they are at that point clean, sober, ready to try and establish a normal life. The transitional housing is a key component of that, and data shows they are very successful if people complete the programming on helping them start a new life. Many times, the joke I used to have working with offenders a lot in my career is, Chris will appreciate this when I've joked about it from time to time with our populations is, the friends you ran with before you got in trouble are not the friends that are going to keep you out of trouble once you get out. So sober living houses is a good way to find a core group, also find those support nets of the weekly or sometimes even daily support groups, NA, Brianna's Hope, some of those kinds of things to help people find that support net to help them on their sobriety and on their recovery. But then also it gives them a safe place to sleep. They know they have a bed, they have a roof over their heads. They can worry about other things other than whether they'll sleep that night. So then they look at what do they need to do for job skills? What do they need to do to look at how do I move from my substance use disorder into recovery and then into becoming productive? My joke was working with offenders, people would ask me, well, why do we do that? And some of you know my sense of humor, that we're going to be taxpayers out of them. Help them get employed. They pay their taxes. They become productive. Between a place to stay, a job, and transportation, all the data on just about any study will show you those are three of the key components of someone successfully transition, not just out of recovery, but out of prison. If they have those three components, they are exponentially more likely, and I forget the exact numbers, it's at least 10, 20 times more likely to be successful in staying clean, staying back out of jail, those kinds of things. So those transitional housing pieces are a core component of that. And like Marty said, that is why a lot of us in our world, in the recovery world, struggle sometimes with seeing some of the houses where, in full transparency and blatantly, they're landlords and it's money grab. They charge, many of them charge $150 a week for the bed. You multiply that times 10 or 12 beds. It's not hard to do math. But are they providing supportive programming? Are they only providing the bed? For that $150 a week, is there programming tied to that to help them stay clean? Even if it is just faith-based groups. Faith-based groups have tremendous success with some populations. I'm an advocate of the full behavioral health model, but that's the world I've played in for the last 12 years. I've been in healthcare, I've been in medical assisted treatment, those kinds of things. So they all have their role, but the key component, and Marty spoke to it, is what is the structure of those houses? Are they truly providing supportive housing? Or is it just a bed and a money grab for a landlord? And that's the dilemma that a lot of us wrestle with in this community, the recovery community.
With this new state enrolled act, is that gonna put a damper on? They're gonna clamp down on some of that stuff? Is there any teeth to that?
Well, I think that's what Marty said. We're waiting to see what the regs are.
It's going to all be permit driven.
Yeah.
And so you're going to have to ask first before you do it.
Yeah.
And I'm assuming there's going to be some enforcement mechanisms. I believe it goes through DMHA. I believe so.
I think that's what the last one I saw was, which DMHA is where all the state runs all of its treatment facilities and regulations through.
I would expect there to be a lot of rules.
Yeah.
I've heard that people were not getting the same rights that they would as being a tenant.
Yes.
You got 30 days notice. All
If
sorts of
that,
things.
I've heard people getting thrown out. As soon as they drop a drug test dirty, they're out that afternoon.
Right.
And I have so many questions on that. How in the world do they monitor that stuff? And
That's what this
Are
law is
some of
supposed
these
to take, because there really, before, hasn't been a whole lot of monitoring.
are a lot of these offenders who have graduated recovery are thrown back into the same neighborhood they came from?
Occasionally. You know, it depends on, do they even go to sober living? A lot of folks just come out and land back where they were. The ones that do go to sober living at least have a little bit of structure. And then to the other end of the spectrum, the ones that have programming and support services and access to different kinds of care, those tend to be a lot more successful. And I don't have those numbers at my fingertip. I was a little unprepared for this one, but you know, I could pull some data for you and find some of that out if you would be interested in it.
It's kind of and we've dealt with them before, and they're kind of a beast to deal with because they have so much going on, and we've never really had any luck, especially when it came to rest care residents. I mean, we would call them to help us out with certain things, and it was like, whew, I don't even know that we ever got help from them, did we? And
That's my question.
And they just had, because they just have so much going on that, so I don't know what type of enforcement they'll actually do. But I know in our experience dealing mainly with the rest care patients, we had no luck with that organization at all. In fact, I think one time we called them and they told us, well, we're getting ready to go to lunch. We can't help you with that. Or it's time to go home. We can't help you with that. So we'll see.
And I know, piggybacking on what the sheriff said, I spent several years in community corrections in Delaware County. And a key component of that is, like I say, the houses that provide what we call wraparound services, case managers, social workers, full-blown mental health behavioral counselors, tend to have a lot better success because you're serving that whole person. You're not just serving whatever their need is today. Okay, maybe today they're thinking about relapsing. Okay, you deal with that, but then you're also looking at what do they need to be set up for success in the future.
So if I could chime in?
Yeah, come on in.
Okay.
Yeah, come on. Thank you.
So a couple of things about that. So when you get into DMHA certification, they are also, once they get certified, they could also be certified through Recovery Works, which would provide funding for individuals who are justice involved to get housing. And so that helps with the payment of that. And then the one position that is paid out of the opioid settlement funds currently is our treatment coordinator, who assists in the transition from one home to the community. So they do that while they're currently residing in a resident. So like if they're currently in like a recovery home, first of all, they help get them there. And so we will only send a certain ones. So the ones that are not probably the most ethical approaches, we tend to not use those as much as possible. And we look at the ones that have a longstanding working relationship and the use of best practice standards. Some do have to go to some of the other ones that are maybe not evidence-based yet. So it may put some extra effort into getting some people up to speed. But also this person who's currently being paid here helps with getting them in. They have a good knowledge base of which residencies provide which types of services, both for longer residential services and transition back into recovery and sober living homes. And then helps with when they transition out, where will they be going? Because you're right, if you put them back into where they started from, they tend to struggle because you've just removed them and then put them back. And so your hope is that they've developed some skills. Sometimes they do. Sometimes the environment is the problem, is part of that problem. And so, there are some things that we're already working in that are going to help with that transition, hopefully to get them back into probably a better suitable housing, whether that be preparing them to go back into that environment and helping them develop the skills to be able to stand in that environment, or building their awareness that maybe they need to be somewhere else and helping them kind of navigate through that. So we do have some of that happening already, but there is that concern once you take them out and put them back in. That's the struggle sometimes too, when you put them in a 28-day residential and then you don't have anything to help them integrate back and put them right back in. That's why it's important to have somebody working on that for them, because it will have a lasting impact if they're not given the skills or the opportunity to relocate. So I think that's a great question that you were asking, because that is a real problem that we see.
Lack of housing, lack of good housing choices.
Or even when they're done, and if they get kicked out. So we get a lot of people, they're removed immediately.
Right.
And then where do they go?
Yeah, where do they go?
Depends. Sometimes they go next door. Sometimes sometimes they go to a friend's house or a family member's house. Sometimes they have to scramble for another sober living home. And usually that requires work from our treatment coordinator to help navigate through that. But generally we try to get them into another place in the community. Sometimes it means they relocate to an adjacent county because they have beds available. We don't always just keep everybody in the county, because the other options in other counties are sometimes a better fit for them. So it's not one house fits everybody, because the needs are different. So we have somebody that sifts through that for us to help better get them into the services that they need.
Our neighboring counties, do they have, I wouldn't say a plethora of choices, but do they have more than what, say, we currently have? Or do they just have different options?
They have different, I would say
Okay.
they're different options.
Just curious.
Yeah, different options with different philosophies and different funding sources. And so I would just say they're just different.
I think people would be surprised how good of a job Grant County does in offering programs and things to individuals. I mean, we met with Wabash County not too long ago, and she just told us we just don't have the resources Grant County does. We don't have,
Nice.
They're not able to do a lot of the things that we do. And people would be, I think, surprised at how well we work together, whether it's law enforcement, probation, with the courts. Because I've been to training before where different government agencies within counties are just at odds all the time. And they're surprised how well we work with our probation department, DCS, with the courts, with the judges and prosecutors. So we do have a lot of programs that I think a lot of people don't realize, so that we do have a lot of options here.
Melissa, just out of curiosity, and I don't mean to throw this curveball at you, but is a probation run residence even a possibility? like a court services recovery residence.
I'm gonna hide under the desk there.
That would be a long, I think, multi kind of stakeholder meeting that we'd have to kind of navigate through. They do have some like work release centers that are for mental health, like Vigo County has one that's like a work release mental health facility that Vigo County does run. So are they possible? Yes, they are. It would require a significant investment in the county's part to have enough to staff it. So you'd be talking about staffing an entire whole
Treatment facility.
facility. Yeah. So yes, and I think Huntington County has one up in their through community corrections. Chris, is that Huntington County?
Yeah.
That's fairly new. So short answer is yes, they can be done. It's just about how you would fund it. But yes, you could do, it'd be like kind of like a therapeutic community kind of venture where you would have them incarcerated and receiving services at the same time.
Thank you.
Well, good job on waiting on that curveball and taking it to the opposite field.
Which,
Get hit.
when you go to trainings and things, when it comes to that sober living and the homes, which counties do you think are just knocking it out of the park? Like, I mean, they're getting recognized for the programs, all those things.
Well, so they all operate differently. I think it depends on what their individual county needs are. In all honesty, I think we're doing a pretty good job in terms of what we're doing. Most people don't hire positions like we have, like the treatment coordinator. So we're ahead of that in terms of what we've got offering to people, because usually that falls on just probation officers and they just don't have the time to do it. So it just doesn't happen. You know, there's not a whole lot of care coordination. So I would say, I don't know that there's a particular, Chris, do you know of another county that's kind of ahead of the curve there?
Again, it's like what you mentioned. It's various locations about different things that they meet, but nobody that meets everything. So you mentioned Vigo County. It's a great county to talk about, but at the same time, they don't have the services and the things that we offer with the probation. So they have a great work release setup and dual diagnosis. They use their CMHC money instead of giving it to them. It goes into the dual diagnosis facility. But there's still a lot of money that's involved in that part of it, but they don't have the active probation part of it. So that's the trade-off. They look at the community and said, this is what things meets our needs, and that's where the money is.
And Shannon, if I can just interject, because they're too humble to say it. Our county is really looked upon as doing a great job with our probation programs and programs that we offer and how well we work together. And I think that's probably a hidden secret in the state, but our probation department, community corrections, I know from people I talk to from other counties, I mean, they do a great job, and I think they set the example and the standard for a lot of counties. But I know they're too humble to say it, so I'd say it for them.
It's good to hear.
Appreciate that. So, yeah, I mean, it is kind of hard to answer that, like, just with like, oh, this county's doing the right thing. You know, there's always trade-offs, and you know, we've always remained committed to trying to do the best we can with what we've got, you know, and trying to stay ahead of, you know, what we're learning and saying this is the next thing we need to be focusing in on, and try to chase after that, because we know if that's what the research says we need to be doing, that's what we're committed to doing. So.
Thank you.
I'll make a point to try to get those regulations as soon as I can. I don't expect them out for another month or so, but I'll take a look, get them, see what they look like. I'm not sure how much the committee's interested in that, but it seems there's a significant need for that type of housing. So what the committee's role, I don't know yet. You can find out what's in those rules.
The good thing for this committee is they'll then have a list of those ones who are doing well or aren't doing well, meet certification or not.
Oh, for sure. Yeah, that's going to be part of it.
Yeah, so that'll be good for.
Yeah, if DMHA is in charge, then I would expect there to be some sort of state registry that's going to be searchable. So I'll do some more homework on what those statutory frameworks are going to look like.
Thank you, Mr. Harper. We'll move on to item number 5, the sheriff.
All right, thank you, Mr. President. Kind of just to start off with, we have Dr. J That's what we call her, so. She's here, Captain Camry. They're going to give a little presentation on what we're requesting, but kind of to go in and to lay the framework. We do believe that the jail plays an important part in the recovery program, and we think that we can, because they're already a captive audience, so to speak, in our facility, that we can offer some things just like Hancock County does to help bring this issue that we have with opioid addiction and even mental health addictions down to where we can affect recidivism within our county. Because I think an important part of getting our jail population down is getting the recidivism rates down. I think that's key to doing that. We do a great job with probation. We do a great job with the courts. Obviously, and I've mentioned this in the past, it's like a three-legged stool. You have to have all three legs in order to properly get this population down. And I think the third leg to that is bed space for inmates so that we can properly implement such programs that they're going to talk about. So I'll give it to them to go over what we have here.
Thanks. I appreciate you guys giving me the opportunity to address you today. This presentation that I'm doing today was done Friday in front of the Marion City Opioid Restricted Funds Committee. And so we're asking both committees to participate. We feel like that's a great way to connect both the city and the county in a common issue. And I'll speak a little bit more about that, but Dr. Jay's helped put this presentation together. And you can talk anytime you want if you want to come up and talk. So if you look at just the reality of Grant County, you guys know these statistics pretty much. We have, a capacity of 274 beds. As of Friday, the current population was 343. It's 348 today. We have 269 currently here and 79 that is out of county. Approximately about 700 warrants are active and approximately about 1,500 people that are on probation. These factors directly increase the demand for behavioral health services in the jail. Historically, jail treatment was coordinated through probation and Department of Corrections grants, but because of restricted funding and a lot of those grants going away, we've had to try to think outside the box on how we can bring services into the jail, which that left a specific gap for us. And so how do we manage high-need individuals that need treatment services and some infrastructure? Obviously, as we go through this, we see, I have to be able to read that. So a significant portion of individuals in the jail experience serious mental health illnesses, substance abuse disorder, co-occurring conditions. Many enter the jail in crisis and withdrawal, and jail staff are often the first responders to the mental health emergency. So other than officers, on the scene, making decisions on what to do with these individuals, the jail is primarily the tip of the sword, right? They come to us, and we're talking about people that are in the criminal justice system that are going to be arrested or going to have some type of problem that the officers are trying to figure out how to bring solutions to that. So with that, the challenge is when no dedicated staff are present, we have delayed or missing mental health screenings, behavioral symptoms treated as disciplinary issues, increased use of segregation and restraint. The risk that we have in the jails is suicide, self-harm, aggression, and medical emergencies, people being taken to the hospital and then being admitted, those types of things, staff injury and burnout. So we get them, they come off the street into the jail, and now they're in a confined space and they are acting out with some sort of disorder when it comes to drug-induced psychosis or just addictions, and they have to be treated. And so what we're looking to do is to have someone who has the credentials to be able not only to make the assessment of what needs to happen, but look at them as an umbrella, right? A point that they can say everyone that comes into jail, we have all these different programs, and we want to connect with probation, with outside services, a lot of the things you even heard today, peer support services, those types of things. This person would be a coordinating individual to make sure that everyone at least was assessed to see what was appropriate for their condition. So it'd be on a case-by-case basis, right? So a real incident example, we just had someone come into the jail under influence, began severe withdrawal, requires consistent monitoring. Multiple deputies have to be assigned to that. If we have to put them in a padded cell, then we have to put them there and watch them every 15 minutes until they come off the level 1 suicide watch, or if they're coming down off of drugs, we have to make sure that we fill out all the proper forms so our nursing staff has the right information. The situation consumes manpower, increased risk, and there can be loss of life that is a potential. So that's another thing too that the county has to be aware of, that those are increased liabilities. So what happens without dedicated staff? We've said this already, but delayed mental health response, increased use of force, right? They don't want to participate. They don't want any type of help, and then that means we have to force them into a cell, or we have injuries in our staff or on our staff. I mean, when we first took over in 2023, we had one person who's well known. If I mentioned the name, everybody here would know, that was responsible for about 80% of our costs for injury to our deputies, right? That he was always fighting. And he's an individual that goes to the state hospital. He stays there for 6 months and he does really well. And they have him on a regimented medical treatment, does well, comes back to the community, does outpatient treatment, stops his meds, and then all of a sudden acts out, gets arrested. And then we have all of these costs because he fights every time he comes into the jail. So that causes staff burnout, problems that escalate instead of being managed early. Improving safety for staff. So staff benefits include clinical guidance during volatile situation, reduced use of force incidents, less exposure to traumatic events, increased confidence in managing mental health behaviors and addictions, and then strong collaboration between custody and care teams. A lot of the people that we've listened to even today, having a liaison into those types of programs. Maybe it is someone that goes through Judge Meeks' court and has all of those things adjudicated, and then we work with them and then hand them off to a sober living environment and follow up in those types of things and making sure that they're getting what they need. Improved jail operations, so fewer behavioral disruptions, reduced disciplinary reports related to mental illness, shorter crisis response, better housing placement decisions, where we're going to put them, more efficient use of medical and custody resources. Counties have a constitutional duty to provide adequate mental health care. Dedicated staff helps proper documentation, timely assessments, appropriate interventions, and it reduces the risk of lawsuits, federal scrutiny, and costly settlements. Fewer emergency hospital transports, reduced medical complications, lower overtime for crisis incidents, fewer prolonged jail stays, reduced recidivism tied to untreated mental health. Why a dedicated position matters. It centralizes mental health coordination and improves screening, supports officers with real-time expertise, creates consistency in care, and lays the foundation for future expansion. We're wanting to start small, right? We're looking to maybe have about an impact on maybe 10 people, right? Because we have a limited amount of space in our jail now, but we do have the ability to put people into different counties, and so we can free up some space so that some of these things can be implemented pretty quickly. Improves safety, reduces repeat calls for service, supports community mental health goals, and benefits the entire county. What I was saying to Marion when I was talking to them, I said, Well, they're our biggest customer. MPD brings us the most people into our jail. Grant County Sheriff's Office is second, and then you have Gas City, Fairmount, and the like, right? So if you're on the scene, and I know that, Chief Gilbert, Sheriff Garcia, how long do you want to tie up an officer? How long does somebody have to stay with an individual that has these types of issues? You can call the crisis intervention team. Sometimes they'll come out and they need to be transported somewhere, and then someone has to go up to Radiant and stay with them. But usually and eventually, if the crisis is severe enough, they come to the jail anyhow. And so when they come to the jail, we want to make sure that officers understand that we have the sufficient ability to also be a drop-off point, that they can get the help they need. So sometimes it could free up people from having to sit on somebody so long, right? That they can just bring them to jail. We have the coordinator, then we can start doing the assessments and see what's appropriate. And then that frees up officers and time on calls. So call to action, establish a full-time behavioral health liaison embedded in the Sheriff's Department to improve screening, crisis stabilization, officer support, coordinate reentry planning. The role shifts from jail, from crisis response to prevention, improving outcomes, and reducing avoidable costs. Intake screening, clinical assessments, biopsychosocial. That was Dr. J's word there, right? Now that's a part of anthropology, and as a minister of the gospel, I would say there's theology there, but we'll do the biopsychosocial, trying to help them in their assessment, safety planning, pre-release planning, appointments, schedules, coordinating with probation, in-custody coordination, stabilization support with medical, custody, and community providers, and then post-release follow-up, confirmation treatment, linking those types of things. So let me move on. These are some of the financial asks that we have. It's estimated between $72,700 and $97,700. Required training, technological documentation. City of Marion would provide $50,000, and we're asking Grant County to provide $50,000, right? So to reduce this intended impact, reduce suicide, withdrawal-related incidents, improve safety in the jail and operations, stronger connections to treatment during custody, and fewer repeat jail bookings if we can do that. And here's some information. So I know you guys have been to Hancock County. And so we have a grant right now that is doing some MRT in our jail. Now, they just hired someone to actually do the class for us, but it's called QC360. The QC360 grant that we have comes from the ISA, or the Indiana Sheriff's Association. The person that's in charge of the Q360 program for our QCC medical provider is also hired by Hancock County. He works there mainly full-time. And he was just up here at our jail last week. We had a great meeting together, and he would tell you, and I can have him come in if you wanted to talk to him or whatever, but the same thing that we're asking right now is actually implemented in Hancock County. They have a person that works for the sheriff's office that is the coordinator for all of these different programs. And since we're kind of behind that, because we've never really done this in the jail before, we would be doing a similar operation in the sense that we would hire a coordinator, and then they would have all of these different tools that they could do or be available for each individual that comes into the jail. Maybe, they go through the probation pretrial assessment, and we can do home detention. Okay, that's an option. But maybe they also need some type of follow-up for addictions. Well, our assessment coordinator can look into that, contact probation, and let them know, hey, this is what we found out. Maybe it's somebody's going to be here for a while. So we move them into a block in the jail that has that program, say MRT class. So we move them up on 3, have a little place that I can put them, and we can get a cohort going. We'll put them in there until they are adjudicated or bond out. So there's a lot of options, but you have to have somebody that is not only trained in this, understands it, has worked it. The only way it's getting done today is because it has to be a serious enough problem within the jail that it comes to my attention, and then I work 3 or 4 days on one case. My position where I'm at right now, I can't do that. I've got too many irons in the fire, and it's difficult. So they're only the acute cases right now that are being treated. So what I'm saying to you is that if we really want to help people, we really want to make an impact, this position would really help us to be more broad in the ability to work with the court systems, to work with probation, to work with our inmates that are going to be there for some time to get them the necessary treatment, the necessary assessments that they need. And I'll let Dr. J, if you want to say anything, you can.
Thank you. Thank you. Hi, good afternoon. I apologize for my dress. I was not intending to speak today. So, well, first let me introduce myself. My name is Dr. Jada Montero. I am the opioid settlement coordinator for the city of Marion. I'm a contracted consultant for that. I'm also a local therapist with Alliance Health Centers, and I'm a professor for the IU School of Social Work. So a couple of things. I have spent the last several months conducting a needs assessment. I actually have approval to share that with this board as well. It's about 20 pages, not too much, but it has just some gaps that we saw when we talk about needs in our community, specifically the city of Marion, but Grant County as a whole. I was able to look at that information from one-on-one interviews with nearly every recovery home in the county, as well as with Radiant Health, which is our sole addictions provider in this county, as well as other counseling agencies and other providers such as Bridges to Health that are super important to being here. As well as Marion Health and Radiant Health have both completed community needs assessments in the last 2 years. So I was able to gather all of this information, including from our state dashboard, and put it all into one. So I will, if anyone would like to share their email with me, I will happily send that report to you all. So when it comes to looking at the needs and the gaps here in Grant County, I will share that we've got needs everywhere, right? And I think the important thing is to steward this money effectively and responsibly. And one of the first things that came to our attention was the needs at the jail. We've had multiple meetings over the last several months about how do we help solve the issues that are there. And first, I'd just like to point out that we talk a lot about the recovery housing here in Grant County, but what we don't necessarily recognize is that Housing First is an initiative, right? If I don't worry about where I'm laying my head, where I'm getting my next meal, I'm able to focus on other things such as my mental health and my sobriety. Okay, the jail provides that. I know it's not cushy, right? We're not on an island, and we did some things to get there, but it does provide Housing First. So it's the prime environment to start targeting some of those thoughts that lead us to using in the first place. So if there is a person that can kind of direct where services go, you're also able to assess for risk of use, safety concerns, it's ideal. Another one of the needs that came from my assessment was just the lack of warm handoff that we have here, right? So someone is perhaps getting out of jail and maybe they're not on probation or connected with any of our courts. How do we know that they're connected with the services that they need once they get out? We don't, right? This person could take care of that. Also, this person could be in charge of identifying not only who's appropriate for what group. Maybe they need more recognition therapy. Maybe they need seeking safety, which is for individuals that utilize substances but maybe have been involved in some type of traumatic experience, right? They can keep track of those things, right? These people we had 50 people come into our jail, we assessed and we referred them or put them in the seeking safety group. right? They completed that group, they were released, and this is what recidivism looks like later on. These are the numbers that the state and other organizations are looking for when we talk about bringing more monies into the county to help us solve these things. So yeah, I think that there's great benefits to having a position like this in the jail. Obviously, the city is interested in partnering with the county and whatever that looks like. The way that this came to us by request was for an RFF that we released. So our plan is to award that RFF in a couple of months, which is the $50,000 that you mentioned. And did I miss anything?
No,
I said a lot, huh?
no, you're good.
Okay, all right.
Thank you very much. I put her on the spot, and I know she didn't expect to speak about that, but we thank you for that. Yeah, and as she said, the coordinator, and let me just end with this thought. No matter where we go as a county, as far as building a jail, opening up new facilities, those types of things, no matter whatever happens, right? This is a must as we expand. If we're saying that we have our facility right now is too small and we need extra space and we need some programs to help recidivism, this is an essential link to getting all of those other things done, right? So for example, if you do decide to build a new jail sometime in the future and it's got 460 beds and it's a pod system, this person will be able to then not only as we have people housed with no mix, right? That's basically what we're doing right now. We will be able to change the way in which we house, right? With the ability then to categorize and put people in not only programs, but have the proper categorization. And we'll have somebody that is answerable to the sheriff and myself and to my staff, and we will work in conjunction to making sure that now we've moved from a footing of just putting people in a block and waiting for them to be adjudicated to where they can have the initial steps of getting treatment that then can be followed up with in a variety of ways.
I know we're against time constraints. I have one quick question.
Yep.
If this were to go through right now in this current facility, can you implement this program? Do you have the space? Do you have what you need?
I do. We are moving right now with the new person that QC 360 hired, right, and the director. We met and we went up onto our third floor. If you go up to the third floor, you'll notice that I think it's the D block. It has 3 cells, right, and you can put 2 to 3 people in each cell. It's got its own table, TV, and bathroom, right? So what we can do with the MRT program, we can assess and get between 5 to 6 people in that program. We can bring them out of population so they can become a cohort unto themselves and put them into that part of the jail, right? Now that means I do have to move people out of county and to open those spaces up, but I can do that right now, and we can start right away with that tool, right? And that person would help us to make sure that that's being done correctly. And then the other thing 360 does for us is that it does all of our data follow-up. So the guy from Hancock County says, we've went out at least 4 years, and we have about a 79% success ratio. That's what he told me. I haven't seen the data, but it is pretty successful. You guys were down there. You probably saw what was going on. So even if we get close to that, right? I mean, that's a huge improvement, I think, for our county, or at least it's a beginning, okay? As we get more things that come online, more space or something like that, other things can be a possibility and we can expand. So yes, to your question.
I definitely think the position's needed. I mean, I've heard that in Hancock. Obviously, that we need to be assessing the needs as they come in. And I think for me, I want to make sure that Marion stays committed to the match. So I don't know how long that would be. I don't know how much their funds are. So, I mean, stay committed to the match. I'd like to see a job description.
Yep, I can do that.
And then, this would be a non-union employee position, right? So I want to make sure that, they're following, we know whose handbook they're going to follow. I definitely see the need there. Like you say, no matter what facility is in the future,
Yeah,
we need to be assessed on the needs. And it sounds like you can do that program.
yeah.
And so I think it's a good thing, but I know you just want to.
Couple of questions. City of Marion has already committed to the match?
No, we were hoping.
Okay.
No, the city of Marion has not already committed to the match. We have a process, so we had 14 organizations apply for our RFF. We took 8 of those organizations, one of which being the Grant County Sheriff's Office, to the second round, and we are making determinations. Our advisory council, which is just made up of different people around the city, which is kind of cool, will have those final recommendations. We will take them to the mayor and we will get city council approval for appropriation of those funds when we're ready. But one of the questions our advisory council did have was, well, what's the county thinking about this? So I think we've been kind of waiting on each other.
I think it'd be a great partnership, in my opinion.
And maybe I could just follow real quick on your comment too. So I think eventually what you'll see for long-term stabilization in this position, that this would be moved into our total healthcare budget for the year, right? So we would go to the council and say, I think it was 505 last year. If we're saying it's 100, right? We would say in a couple of years or a year, whatever, it's going to be 605.
Yeah, whenever the funding runs out, I mean, obviously you want that position to be full-time.
Yes.
It'd be needed.
Yep.
Can you speak briefly as to what would distinguish this position from the coordinator that's already paid out of these funds and individuals like Tyler Small?
Yeah.
What distinguishes this position from those?
Well, this person is going to answer directly to the sheriff and to the jail population in total. So every person that comes in to the jail, right, and who's currently there will have some type of assessment, and we'll have some type of way in which there'll be a plan that will be for them. So maybe they get assessed by Tyler and they're in pretrial release, that type of thing or whatever. This person then will say, okay, that's what this is. This person's that's appropriate for them, right? But there are people that are in jail, right, that are not affected by some of these programs that we're talking about, and we still want to be able to provide services for them, or at least get them assessed and see what their needs are. So it's a complete, it's the, like I said, when I said tip of the spear, it will be everyone that comes into the jail, and there will be an appropriate demarcation, I guess you could say, or appropriate way in which we will funnel those people into the right things. And we'll cooperate with all the outside entities in doing that. I think in the past, the sheriff's department has been a little bit lacking, is that we were always at there were always outside entities controlling all of that. And then we would see that there are people that seem to be left behind or need some help. And then they kind of went through they didn't get the treatment, or they didn't get the assessment that they needed. Or if they did, they weren't appropriate for some program. We want to try to make them appropriate for something.
And what they'll be doing also is coordinating with the programs that we have within the jail. So this guy may qualify for MRT, so MRT would be good for him. This person, we've talked about some type of discipleship program through our chaplaincy program. Hey, that might be good for them if they're willing to go through it, or JCAP, once we're able to implement JCAP in our facility. So they'll be able to coordinate internally through our programs, and then also work with the outside coordinators, because what we feel what's happened is, and I think someone mentioned it earlier, they come out of the jail and oftentimes there's no foundation built, right? So they get put on probation, they get sent back to their old environment. So now they're trying to build a house on the sand, and the winds and those temptations come, and the house falls. So what we're hoping to do is be able to provide a foundation, a resource. If you talk to Wabash County, their JCAP program, their jail chemical addiction program, it's an 8-hour-a-day program, 5 days a week. Not only do they go through substance abuse programs, they also do life skill programs where they get people from outside that come in to teach them how to cook, teach them how to do their finances, they do yoga or whatever. They just have a lot of different things that they do. And this individual will help coordinate those programs too.
And Judge, part of it too is a loss of funding. So jail treatment with that, part of that was what Tyler did. So they're really replacing with this what some of the things that he was able to do, but we lost the grant funding from that.
So is Tyler no longer with?
No, Tyler's still here.
Oh, okay.
And he does reentry screening and things that we do, but he's doing a lot of home detention now because we lost the position on that too.
If I could just add one more thing, I really appreciate, one of the questions our advisory committee had was about sustainability, right? Because these funds aren't never ending. However, there are opportunities for these, for this particular fund. Within my time of being here, the city of Marion has signed on for 2 additional settlements to receive additional funds. And there are also grants that are available. So whomever is chosen or employed for this position, if that's what you all choose to do moving forward, I would make sure you include in your job description that you should be actively looking for grants to continue to keep this going. There have been at least 2 grants in the last few months that can be utilized. The city of Marion applied for one through CJI. There was one through DMHA recently. So there's opportunities to ensure that, someone that wants to stay employed will continue looking for the grants, right? And we have that. So just idea.
Any other questions?
As you get into your numbers a little closer, your benefits top end is drastically low. I can get you accurate numbers if you need.
Thank you.
Thank you.
Thank you.
I'll be real quick. Number 6, settlement status. For the next meeting, I will circulate some information that shows all the different settlements. Nationally, there appears to be about $50 billion that's going to be dispersed from over 10 settlements. And the payouts are somewhere between 5 and 18 years. And what I've been able to gather so far is that Grant County is going to get $3.6 million, and 2.5 of that will be restricted, and 1.1 will be unrestricted. So we will get something more detailed in that show the payout over time. But we'll have that ready for the next meeting.
Okay.
Do we want to hear any more information from? Do we need any more information from the sheriff? Or, I mean, so far this body hasn't agreed to really appropriate or commit to any dollars, right?
I'm sorry.
This body hasn't agreed to commit to any dollars. Do you want to take a vote on? Do we want to proceed?
Sure.
With what?
You can. The committee would need to take a vote to recommend it to the commissioners for approval, and it would need to go on the commissioners' agenda.
Are you looking
To approving number 5?
I'm sorry?
Yes.
You're looking for a vote for number 5?
Well, I mean, what are your thoughts?
Well, full transparency, if I understand the conversation between Grant County and City of Marion, I think that may be the same funds, Dr. J, that I presented for, the 50,000. So, I mean, I will abstain. So I had submitted a proposal for Family Recovery Court. So I think it is a worthwhile position that Sheriff and Captain Camry have presented, and I would be in favor of it, except to the extent that it may take away the 50,000 that I was asking for from the city of Marion. So I will abstain because I think just in full transparency, that would be appropriate. So, but I think it would be a worthwhile endeavor as far as the presentation.
When will the city award? You said 2 weeks?
We have one more committee meeting next month to consider all of our funds. After that, my intention would be to take it to the mayor, and it would likely be on city council's agenda for June.
Our
I think
next
that
meeting
we-
would be June 18th. Is that
Our next meeting is the 15th.
15th?
Am I correct, Dr. J? There's just the 150,000.
We are awarding 200,000.
Oh, so there's up to 4.
Yeah.
Oh, okay. Well, I'd vote in favor of it then. Still got 3 more chances.
Find out the results. So are we looking for a motion to approve 50,000 of opioid funds to the sheriff's department's plan? Is that what you're asking for?
I would say the motion would be to approve, the 50,000 of settlement dollars to the sheriff for an employee pending.
And this would go up to the commissioners for final approval.
Would it be pending also the city of Marion's participation as well? Because,
Yes, yeah.
if you get half, are you still able to do your thing or not?
You have to find a grant or something, wouldn't you?
Yeah, we try to find money elsewhere too, so.
Right.
It would just it would delay. We would just have to find
I
something.
mean, can we do our part to go ahead and
Yeah, I think we need to
contingent
show that
upon,
Marion that we're committed.
I mean, is that fair?
And then does it go to the council after the commissioners? Is it's a 3-step
No, it's out of the
process?
opioid fund, right? So
Say that again, Judge?
But it's still
I think
a
it has to go
hire,
to council.
and the council
After
knows
the
the hiring freeze.
I suppose since there's a hiring freeze,
There-
it would be funded.
Not, I'm unsure
No.
on the
Well, the-
restricted. It
The,
has to go through both.
I would think both.
Tracks the money. They have to appropriate it,
Yeah.
yeah,
and then Angie tracks it.
well, the position would have to be approved by the council,
Right,
no matter what.
even though it's funded through the opioid settlements.
Oh, yeah, it hasn't already been appropriated yet.
So we can make our recommendation to the commissioners. Commissioners then would take their final decision to the council, and then the council would vote on it. So, but we could put ours in, contingent on the city of Marion matching and so forth, if that's what this body wanted.
I think that's the right thing to do.
So I'll make that motion, Mr. President, that we approve the presentation that was presented today by Captain Camry and Sheriff Garcia and Dr. J. And that this body make a formal recommendation to the Grant County Commissioners that this position be created through the use of the opioid funds, contingent on the city of Marion investing $50,000.
I would second that motion, Mr. President.
I have a motion from Mr. Meeks, a second from Mr. Brinkle to approve the 50,000 from the recommendation of Dr. J, the sheriff, and Jason Camry, and contingent on Marion's 50,000. Correct. Are there any other questions or comments? All those in favor signify by saying aye.
Aye.
One abstention. Motion carries.
Yeah, another question I have, maybe it's a little late, is I heard her say that may not be quite enough to carry the
Yeah, so
shortfall,
assuming,
then what do we do?
assuming an employee that's going to cover family under medical, vision, and dental insurance, as well as our life insurance, you're looking at more like 38,000 for the top end of the benefits area, with the low end being 12,500.
So if that were the case, we
For an
would just
individual.
revisit the opioid fund.
Yeah, I would assume that whatever the salary and benefits are, that we will make a recommendation to pull it from opioid, whatever that is.
And they had a $20,000 range on the salary, which may make up for
Make
some
that
of the
up.
shortfall on the benefits, so.
Yeah, I mean, we can figure, we can work it backwards from 100 to see what it actually be as far as the salary. Is there anything else for the good of the order? Anything else for the good of the order? Are there any public comments You want to address the body, come to the podium and state your name and address for the record? Not seeing anyone. Okay, well, our next meeting is Monday, June the 15th at 12 noon. Motion to adjourn?
I'll make the motion.
Second. I have a motion, I have a second. All those in favor signify by saying aye. Aye. All opposed, same sign. Meeting is adjourned. Thanks for that.
Hey, back to trial.